Today's symptoms of COVID-19. Before proceeding, please note that this general overview is compiled for initial self-assessment only and may vary for each individual. If you are not feeling well, you should immediately consult a medical practitioner to have an accurate diagnosis and proper treatment of COVID-19. The typical daily symptoms are concluded from the study of 138 patients at Zhongyang Hospital of Wuhan University, and another study involving 135 patients from Jinyintan Hospital and 56 patients from Wuhan Pulmonary Hospital. These symptoms are broken down into Day 1 to Day 2. The beginning symptoms are similar to the common cold, with a mild sore throat and neither having a fever nor feeling tired. Patients can still consume food and drink as usual. Day 3. The patient's throat starts to feel a bit painful. Body temperature reads at around 36.5 degrees Celsius. Although it's uncommon, other symptoms like mild nausea, vomiting or mild diarrhea are possible to set in. Day 4. Throat pain becomes more serious. Other symptoms like feeling weak and joint pain start to manifest. The patient may show a temperature reading between 36.5 degrees to 37 degrees Celsius. Day 5 to 6. Mild fever starts. The patient show a temperature reading above 37.2 degrees Celsius. The second most common symptom, dry cough, also appears. Dyspnea or breathing difficulty may occur occasionally. Most patients in this stage are easily feeling tired. Other symptoms remain about the same. These 4 symptoms are among the top 5 key indications of COVID-19, according to the final report of the initial outbreak conducted by the Joint Mission of China and WHO. Day 7. The patients that haven't started recovering by Day 7 get more serious coughs and breathing difficulty. Fever can get higher, up to 38 degrees Celsius. Patients may develop further headache and body pain, or worsening diarrhea if there's any. Many patients are admitted to hospital at this stage. Day 8 to 9. On the 8th day, the symptoms are likely to be worsened for the patient who has coexisting medical conditions. Severe shortness of breath becomes more frequent. Temperature reading goes well above 38 degrees. In one of the studies, Day 9 is the average time when sepsis starts to affect 40% of patients. Day 10 to 11. Doctors are ordering imaging tests like chest X-ray to capture the severity of respiratory distress in patients. Patients are having loss of appetite and may be facing abdominal pain. The condition also needs immediate treatment in ICU. Day 12 to 14. For the survivors, the symptoms can be well managed at this point. Fever tends to get better and breathing difficulties may start to cease on Day 13. But some patients may still be affected by mild cough even after hospital discharge. Day 15 to 16. Day 15 is the opposite condition for the rest of the minority patients. The fragile group must prepare for the possibility of acute cardiac injury or kidney injury. Day 17 to 19. COVID-19 fatality cases happen at around Day 18. Before the time, vulnerable patients may develop a secondary infection caused by a new pathogen in the lower respiratory tract. The severe condition may then lead to blood coagulation and ischemia. Day 20 to 22. The surviving patients are recovered completely from the disease and are discharged from the hospital.
Hi there. Today I thought it would be great to get the opinion of a doctor in how to treat ourselves whilst at home. As the majority of people who are infected with coronavirus, their experiences will be mild or asymptomatic, which can be treated at home. So doctor, if someone was experiencing the telltale signs of the virus, what should they do to feel better?
If you experience a fever or a new continuous cough, you should self-isolate immediately. Those experiencing a mild illness don't need to seek medical attention. Avoid sharing towels,
and what do you do while you're
crockery,
in self-isolation?
As with other viruses such as colds and flu, taking it easy and looking after yourself are crucial to your recovery. So you should drink plenty of fluids, drink enough water so that your pee is pale, clear colour. Avoid alcohol as this will make you more dehydrated. If you smoke, you should try to stop for good. Get plenty of rest. You should isolate yourself at home if you have any symptoms of coronavirus and avoid any strenuous activity whilst you are unwell.
Are there any medications for COVID-19?
There is not currently a cure for COVID-19 or vaccine against coronavirus. The aim of treatment is to manage and reduce symptoms until you have recovered. Most people, around 80%, have an asymptomatic or mild infection, which can be treated at home. In this case, you should self-isolate for at least 1 week until you have recovered. 1 in 5 people who contract COVID-19 will require hospital care. Around 15% of cases experience severe infection requiring oxygen to help with respiratory symptoms. 5% experience critical infections requiring ventilation. Those at a higher risk of severe or critical infections include older people and those with underlying health conditions.
What painkillers are suitable?
To relieve pain and fever, you can use painkillers like paracetamol. France's health minister, Olivier Véran, recently commented that non-steroidal anti-inflammatory drugs, NSAIDs, could aggravate the infection. These medications include aspirin, ibuprofen and naproxen, amongst others. Currently, there is no conclusive evidence that NSAIDs will make a coronavirus infection worse. But until there is more information available, you should stick to other painkillers to treat a fever or headache if possible. However, if you have been prescribed an NSAID to treat a health condition, you should continue to take it until you are told not to. Some of the medications and treatments you might use to treat colds and flu will also help with coronavirus symptoms. Cough medicines or cough suppressants can help reduce your cough. However, some of these preparations may or may not contain paracetamol or other painkillers, so always read the label. Throat lozenges and remedies like honey or lemon may improve a sore throat.
What about homemade remedies?
Although there is no robust scientific evidence that homemade remedies work, some people do find them useful. There is no harm in making small quantities of homemade remedies using lemon, ginger, honey or black seed oil in the form of a warm drink to soothe the throat and increase fluid intake, as anything in too much quantity can also be harmful. It also must be noted that these remedies could also distract you from doing the thing which really helped to stop the infection, such as thorough hand washing and social distancing.
What are your thoughts on steam inhalation?
There is not very much evidence that this helps. However, some people find it useful. It is very important to be careful to avoid burns and scalds, particularly with children. A safe way of inhaling steam is to sit in the bathroom with the door closed while running a hot shower to make the room steamy.
Antibiotics.
If you have antibiotics lying around at home, do not take them to treat coronavirus. As it is a virus, antibiotics will not improve coronavirus. You should never take antibiotics which haven't been prescribed for a certain condition.
COVID-19 cures?
There are many natural cures and herbal remedies floating around the internet and in health stores. Currently, we aren't aware of any remedy to cure COVID-19, so don't be fooled by the miracle treatments some people are trying to sell. They could contain harmful ingredients and could also distract you from doing the thing which really helped to stop the infection, such as thorough hand washing and social distancing.
And when do you seek medical attention?
Seek medical attention if you cannot cope with your symptoms at home, your condition gets worse, you still have fever, are feeling generally unwell, or have other symptoms after a week. Your symptoms haven't improved after 7 days. You should seek medical attention as soon as possible. If it's not an emergency, contact NHS 111 online. If you have no internet access, call 111. If there is an emergency and you need an ambulance, call 999 and tell the call handler that you have coronavirus. Even under the new measures announced by the government to prevent people from leaving their homes for non-essential purposes, you are still able to seek medical care of all kinds. You should not see your GP or pharmacist if you think you might have coronavirus.
Thank you, Doctor. That was very insightful, and I hope you guys liked the video and check us out on other platforms. Bye.